Hey, what's going on, everyone? Dr. Taylor of Aspire Chiropractic. Today I want to lay some truth on you. The truth about chiropractic, specifically the truth about chiropractors. So here's the thing. Chiropractic is awesome. One of the best things about chiropractic and chiropractors are there are so many different ways to do it. One of the crappy things about chiropractic and chiropractors is there are so many different ways to do it, okay? I have no idea what it's like to be adjusted by me, and I will never have that pleasure or that opportunity. I say it tongue-in-cheek, but there's a lot of truth in it. Everybody who comes in this office, man, they're in great shape. They're the lucky ones, the people that come here. Why? Because I get to be their chiropractor. They've found the best one. I have to spend the rest of my life looking for second best, but it's my cross to bear. Because again, chiropractic is awesome because it's done so many different ways. I'll never know what it's like to be adjusted by me, but I'm able to know what it's like to be adjusted by other people. I'm able to experience other chiropractic offices, which I've certainly done, so I can figure out the best way to help patients, the best way to run a chiropractic business. I can also figure out the things that I don't like, the things I don't like to do, or things that I don't like to see. Because one of the things with chiropractic, it can get very woo-woo, for lack of a better word. It can get very, let's say, crunchy. Now, don't get me wrong. Those things are wonderful in the overall health and well-being space. However, a lot of those things are not chiropractic. What is chiropractic? Chiropractic is the adjustment, okay? Chiropractic is moving a bone, taking pressure off of a nerve, fixing the juxtaposition of a joint segment in the spine as compared to the one above or the one below. Chiropractic literally means done by hand, the practice done by hand. That's what chiropractic is. Chiropractic isn't supplements. Chiropractic isn't therapies. Hell, we do decompression in this office. Chiropractic isn't decompression. Chiropractic is moving a bone. But regardless of how you're going to move that bone, we need to have a plan, okay? This is where chiropractors differ. There are chiropractors out there, hey, come back when it hurts. Hey, I'm going to adjust you once or twice. That's not how it's done in this office. Reason being, there are two people in your life that should have a plan for you moving forward. Your God and your chiropractor. If neither of those things have a plan, you need to find a new one. Because you come into a chiropractor and it's going to be for some ache or pain kind of thing. There's a whole bunch of other stuff chiropractic helps with, but the majority of people that walk through a chiropractor's door for the first time are there for an ache or pain. And regardless if that thing has been there for 2 weeks, 2 years, or 20 years, it's something that your body has developed. It's something that your body has become accustomed to. It's a behavior. It's a learned pattern. So what do we got to do from a physiological standpoint? We got to teach your body something new, okay? We got to get it out of that old pattern, that old habit. How do we do that? We do that with a plan. So if you're just getting 1, 2, 3 adjustments a year and you're expecting pain relief, you're not going to get it, or you're not going to get it for a very long time, because you got to teach your body something new. So this is the people that, hey, I had a neck cramp or a kink in my spine. I went to a chiropractor. I got adjusted. It felt good for a couple hours, maybe even a couple of days, but then it came back. You know what? Chiropractic doesn't work. No, your chiropractor didn't work. You didn't follow the plan, or they didn't present one to you on how we're actually going to make you better. It'd be just like if you go, shoot, I'm going to go and I'm going to have a salad for lunch today. And if I don't wake up skinny tomorrow, it's not the salad's fault. Number 2, chiropractic is backed by science, okay? The science of the analysis and correction of vertebral subluxation, okay? We need to find it, we need to analyze it, locate it, correct it. What is a vertebral subluxation? It is that bone out of place model. It is that spot in your spine, right there. That bone's not moving right. That bone has lost that proper alignment with the joint above or the joint below, causing your body to compensate, causing muscle spasms, causing issues with the spindle fibers in the muscles, putting pressure or distress on the nerve, sending poor signals up into the brain, or causing the brain not to send good signals out into the body. Chiropractic is backed by science and is the absolute analysis, location, and correction of vertebral subluxation, fixing that bone in your spine, okay? Lastly, here. So they need a plan. They need to move a bone. They need to explain to you what they're doing. So again, one of the great things about chiropractic is there's so many different ways to do it. One of the lousy things about chiropractic is there's so many different ways to do it. Part of chiropractic, part of being a doctor in general, whether it's a doctor of chiropractic, a doctor of medicine, doctor of osteopathy, doctor of dentistry, doctor comes from the Latin word for teacher, okay? We need to explain to you what's going on. Why are you feeling what you're feeling? Where do these symptoms come from? I made a video a long time ago about my disdain for the practice of diagnosis. Now, not in its entirety, but there are some diagnoses out there that are just completely unhelpful. Okay, perfect example, lumbago. What is lumbago? Lumbago is a billable diagnosis. It means back pain in Latin. That tells me nothing. You could come in here and tell me you have back pain. Cool. Let's figure out why. You could send your insurance a bill for the correction of lumbago. Cool, but that's not actually going to make you feel better. Let's figure out why you have the issue that you have. Diagnosis, it doesn't always cover all that stuff. We need to actually dig into it, get below the surface, no pun intended. And then when we figure it out, we need to explain it to you. If you're a chiropractor, or hell, your medical doctor or your dentist, if they're not explaining to you why they're doing what they're doing, going back to number 2, why their plan is what their plan is, that's not a good chiropractor. That's not a good doctor. So we need to have a plan. We need to have the explanation of the plan. And we need to basically understand that we all need to kind of be in this together. I need you to know what I'm doing and why I'm doing it. And I need you to understand that. And if you don't, I need you to ask me questions because I want you to understand this as we go forward. So I love chiropractic. I don't love every chiropractor. I love that you guys have the opportunity to see the best one, though. Because once again, I'll spend my life looking for second best. But I'm okay with that if it means you feel better. So if we can ever help you, walk right through the door, give our office a call. We're ready to help you when you're ready to be your best. Naturally, right here at Aspire Chiropractic. And that's the truth.